Are you doing all the right things with your workouts, your nutrition, everything? You feel like it's all on point, but you're still struggling to lose those last few pounds. Or perhaps you've gained weight, can't get it off. Maybe the hair's thinning, or it's brain fog. And we might not always think of our thyroid as being the cause. I know I didn't until I was in my 50s and was diagnosed with hypothyroidism. I really didn't know much about it. So it may be time to consider your thyroid. The thyroid is small, but it is so powerful because it's going to play a role in your energy, metabolism, focus, mental focus, all of these things. Today's guest has cracked the code on complex thyroid disorders. Dr. Amie Hornaman, aka the Thyroid Fixer, hosts the top rated podcast in medicine and alternative health called the Thyroid Fixer with listeners around the globe. She is the founder of the Better Thyroid and Hormone Institute, which is an organization that has proven approaches to address thyroid dysfunction. Dr. Amie is a doctor of clinical nutrition as well as leading functional medicine expert in thyroid conditions, hormonal dysfunction, and weight issues. Dr. Amie has her own unique story, which we're going to go into today and then discuss some of the cutting edge expertise that she has in hormonal health. Dr. Amie, welcome to the show.
Thank you, Carol. I'm so happy to be here.
So tell me, tell all the listeners a little bit about your backstory. How did you get here? Because I find that most of us who are in the health space, we have a backstory of some sort.
So true. And it usually involves pain of some sort, but
Yes.
we all do have a backstory. Well, okay. So going back into my 20s, which I learned that you are a soul sister of mine also competed. So this is back in the day when I was doing fitness and figure competitions. And you know how rigorous the diet and exercise is for that. I mean, it's a planned out 12, 16-week program where your life consists of going to the gym and meal prepping fish, chicken, and asparagus. And, I had done plenty of those shows. And even every time I would get ready for a photo shoot, I would diet down the same way because, of course, you're in a bikini and all of that. So I would always prep my body the same way. I knew how it was supposed to respond. And then there was this one show I was getting ready for. Now, I was working with a trainer. I totally believe in working with coaches for all things health related. So I was working with the trainer, so I didn't have to think for myself. And I was sending in my weight and my pictures, my weekly progress pictures every single week. And it got to the point where it became very, very embarrassing because every time I was sending him my weight and my progress pictures, the scale went up. And I'm not talking like 0.2 pounds. I mean, 5 pounds, then 10, then 15. I stopped getting on the scale at 25 extra pounds on my 5'2" frame, but I truly believe it went higher than that. I think in total, my body laid down about 40 additional pounds of fat. I mean, it was just fat. I was not putting on 40 pounds of muscle, by the way. Like it was fat. And I had no idea why. I became embarrassed. I started wearing the big sweatshirts at the gym, just covering up my body. I remember dropping out of the show, but I also remember the whispers around the gym, like, oh, she's off her diet. She's eating too many donuts. That's why she's not going to do this show. And it truly wasn't. I mean, I was doing everything to the point where I would even second guess and go, okay, well, maybe I should restrict more. Maybe I should do 3 sessions of cardio a day instead of 2. I mean, it was really starting to basically consume my entire mental space and my entire world. So when that was happening, I did what we all would normally do in that case. I went to my doctor to say, like, something's wrong with my body. It's literally like my body is rebelling against me. And I don't know why. I have no control over it. This is what I'm eating. I'm eating perfectly fine. And my doctor ran some tests at the time, to which I would love to go back and see what they ran and didn't run. But they ran some tests at the time and said that you're normal. Everything is fine. You're normal. But it must be something you're eating, something you're doing. So they always would put the blame back on me. Now, I say they because I didn't stop at doctor number 1. I actually went to a total of 7 different doctors. And I heard all of the medical gaslighting that we still hear today, that I still hear from my patients today, the same words, the same language coming out of these doctors' mouths, that you're normal, everything is fine. Just eat less and exercise more. Well, that's just all in your head. Oh, well, that's part of getting older. You just have to learn to live with it. And it's just amazing that they said that to me in my 20s. They're saying that to women in their 30s, 40s, 50s, 60s, and above. And we're hearing the same medical gaslighting terms over and over again. Well, number one, I always say, you know your body. You know your body. You know when something is not right. So you almost have to block that out because it makes you second guess yourself. The whole gaslighting term is meant, it came from narcissism, basically, to where they are making you feel crazy. Like where you literally go, okay, maybe it is me. Maybe I'm doing something wrong. Maybe I do need to eat less and exercise more. And that just wasn't the case. So I went to 7 different doctors. They all told me you're normal, everything's fine. Now, when I'm telling this story, I obviously can't get too deep into the emotional aspect, but it was bad. I mean, it was really bad. I was seriously depressed, frustrated. I remember crying in my car. I remember just not being productive at work. I wasn't a good friend anymore. I wasn't a good girlfriend anymore. I didn't want to do anything. I just wanted to kind of hole up. And it's almost like you shelter yourself and go into your hole because you are not you. You don't recognize the person you see in the mirror. You don't feel like the person that you know that you are. So eventually, by doctor number 7 actually touched my throat and said, swallow. She was the first doctor out of 7 to lay hands on me. And so she touched my throat because that's where your thyroid gland is. And she said, swallow. And she goes, oh, yeah, I feel this little like bump here, this little nodule. We're going to ultrasound that, but you have Hashimoto's. We call it hypothyroidism, which is an autoimmune form of low thyroid function. And here's a pill. Oh, Carol, listen, that was the best day of my life. I left her office. I'm like, this is amazing. I have a name for what's going on with me now. And I have a pill that obviously is going to fix me, right? 5 months later, I'm taking that pill, which is T4, Synthroid, very, very common treatment therapy for hypothyroidism. I'm taking it every day. And nothing's changing. I'm tired. I'm losing my hair. And the damn scale is still up 25 plus, probably 40 pounds. So nothing was moving. So I went back to her. I started Dr. Googling because that's also what we all do, right? We chat GPT now, or we Dr. Google. And it kept saying this thing about, well, T4 is inactive and there's this other thyroid hormone called T3 and there's other thyroid hormone called T2. And these are active forms and they help with your metabolism and they help with fat burning. And I'm like, well, that sounds amazing. So I went back to her and I said, wait a minute, we're using this inactive form. To my understanding, there's these other active forms that will actually help my symptoms. Can we do that? And she goes, no, that's not standard of care. That's not what I do. And I said, well, I'm going to find somebody who does then. And that's what brought me into the world of functional integrative medicine. Actually, I don't even think we used the term functional back then. This
We
was so
didn't.
long
Yeah.
ago. I think it was like alternative,
Yes.
integrative, right? And I kept hearing the name, just like many of you do, right? You might maybe continue hearing this name of this thyroid expert, right? I kept hearing the name of this guy. And I went to see him and he saved my life. He sat with me. This is what we do with patients right now to this day. He sat with me for 90 minutes, 90, not a 5 to 7 minute visit, which is insurance dictated. He sat with me for 90 minutes, did a boatload of labs and put the puzzle pieces together and explained to me, well, this is what's happening with your thyroid. And this is why you didn't feel well on T4 only because it's pushing up your reverse T3 and your active thyroid hormone is low. And he laid out this plan that literally saved my life. And then he became my mentor because at that point in time, I changed careers and I went into functional medicine and I dove deeper into thyroid and hormones and all the things surrounding it. And that's why I'm here with you today, educating women, helping women, well, helping all people. I don't want to just say women, helping all people. But the reality is that hypothyroidism does affect women. It's like about a 90-10 split, 90% women, 10% guys. So we get hit harder with it. And my goal is for no woman out there to be gaslit and to waste an hour, much less days, weeks, months, sometimes decades of your life feeling like absolute garbage and with no answers and no direction.
Mhm. I really relate to this so much. I was diagnosed in my early 50s with rheumatoid arthritis. And I remember that exact feeling that you described, where I went, There's a reason for why I'm feeling this way. I feel somehow vindicated because I've been, having this fatigue and all these symptoms. And then, oh, and there's a medication. And that's just the beginning of your journey. It's not what you think. Like the medication, yes, it's there, but it is not taking care of the root cause of the issue. So I related to that. Now, I want to ask you about diet and thyroid function because this is what happened to me. So I got the diagnosis of rheumatoid arthritis. And it was maybe about a year later, I did a competition, and my coach at the time, I too had coaches, believe in them firmly, and great coaches, by the way. So I'm not downing what they did at all. But to get me ready for the competition this go round, he did a clean, modified version of keto, which was basically just protein, veggies, and healthy fats on repeat with virtually no carbs except what was in the veggies. And I was on it for months. Got to the stage, looked the worst I had ever looked like no definition, nothing was popping. And, I had my meal, my hamburger, you know how they do go have your pancakes, go have your hamburger to fill up so that you see that pop of definition. And it just never came. And then shortly after, here came the fatigue. And I remember going to climb a flight of stairs and feeling like I could barely get to the top of the stairs and thinking, what is wrong with me? I'm in great shape. What is wrong with me? And so I went to my nurse practitioner who was doing my hormones. She too has an integrative approach. And that's how we found the thyroid. So, long story short, was my competition prep negatively affecting my thyroid at the time?
Well, it could have. So, whenever we look at the onset of hypothyroidism, or we'll say Hashimoto's. So let me back up. When we say hypothyroidism, we're talking about low and slow thyroid function. 95% of all hypo, low and slow thyroid is Hashimoto's, which is the autoimmune form of hypothyroidism. So what that means is you have these little soldiers in your body that they like to go out and attack a certain body part. So with all autoimmune conditions, we have these soldiers, they get really confused. So in the case of Hashimoto's, they think that the thyroid gland is a bad guy. In the case of rheumatoid arthritis, they think that your joints are an invader and they need to go out and attack it. So they're just confused. They don't know any better. So with Hashimoto's, with any autoimmune condition, we know that that trigger, that point of time in your life where the autoimmune switch is in the off position. So let's say you have a genetic predisposition, you have somewhere in your family, you have autoimmune. So that sits in the off position. What flips it to the on position? We know that pregnancy, perimenopause, menopause, fluctuating hormones, which I have a term I call thyropause, which is
I love it.
the definition is when your thyroid gland shits the bed after the age of 40 due to those fluctuating hormones. So we know that that's a trigger. So it could be your age, could be fluctuating hormones. However, we also know that stress is a huge trigger. And I truly believe that the stress of the competition alone, it wouldn't matter if you were on old school bodybuilding diet, high carb, rice, or keto. It's a stressor getting ready for a show. You're putting your body through a very rigorous time. And that stressor is enough to flip that autoimmune switch to the on position. Now, in addition, to go one layer deeper into your question, then we look at the type of diet. Now, it's not necessarily that, let's say, the keto or low carb diet is going to turn on Hashimoto's. In fact, we have enough evidence to say that eating a ketogenic diet or even carnivore can help with autoimmune. It calms down that inflammation because we're not consuming the processed garbage carbohydrates. We're not spiking our insulin and our glucose. So that can be a good thing. However, when someone is on very, very low carb, and obviously if you were getting ready for a show, you were super strict, right? To the T. So when someone is really, really low carb, that can down regulate your thyroid gland's production of thyroid hormone. So we could see a decrease in, let's say, free T3, that active thyroid hormone. We can see a decrease with low carbohydrate for too long of a time. So it's hard to say like which factor in that time frame of your life triggered and flipped that switch, but it could have been any of those.
Mm. I think, yeah, I had a perfect storm going because it was a very stressful emotional period at that time. There were things going on. And then it was stressful physical because of the show and the diet. Then you add in just a recent diagnosis of autoimmune, menopause, and bam, there you go. And it was a shock to me because I thought, well, I'm healthy. Other than the rheumatoid arthritis, I'm healthy. What's going on? So, what happens in perimenopause and then in menopause to change thyroid function, to strain the thyroid?
Yes, yes. Okay. So first, as we're kind of moving down that path into perimenopause, the first hormone to go is our progesterone. I mean, that can tank as early as a woman's 20s and 30s because that's where we'll see some infertility. Infertility can be linked to low thyroid function or low progesterone. Women are on birth control or coming off of birth control during that time, which we know birth control suppresses our own progesterone. So progesterone levels just they just tend to go first. They tank. Progesterone helps with insulin resistance. It helps with T4 to T3 conversion. So the inactive form of thyroid hormone T4, which has to go through a converting process and become active and turn into T3, progesterone helps with that. So that's the first thing that starts to kind of like, oh, my body is out of balance here. I'm shifting. I'm shifting. Well, then following progesterone is testosterone. Now that can go around the same time. It can be a little bit later. By the time, whenever I see a woman's labs and she's in her 40s somewhere, 98% of the time she has low testosterone. And I don't mean flag low, ladies. I'm sure Carol's talked to you enough about lab values on here that it doesn't necessarily have to be flag low. I want to see total testosterone at 50 or above. And I want to see the free testosterone. If you take that standard lab value range, I want to see it middle or above. So I would say the upper half of the range. So when we're looking at those two numbers, 98% of the time they are low in a woman in her 40s. Here's the beauty about testosterone. Testosterone actually protects us against autoimmune. So the stat that I told you about guys only getting hit about 10%, they have way more testosterone than we do. Even a man with low T has more T than we do, than you and I combined right now. So that testosterone is like this armor against autoimmune. And it literally protects a man from autoimmune conditions. I mean, even RA, women get hit harder with RA. We get hit with all the autoimmune conditions. Thank you very much. So that testosterone going down and fluctuating, that can turn on Hashimoto's, turn on autoimmune because our armor dropped. And then we have estrogen. Now, estrogen will go on a roller coaster. Even as you move from perimenopause to menopause, you could be estrogen dominant one day and totally bottom out deficient the next day. So you're really on this wild estrogen roller coaster ride. And again, that's a huge stressor on the body. And that is enough to flip on the Hashimoto switch. Let me make it even one layer more relatable. Let's go to pregnancy. Let's back it up even before perimenopause. Let's go into pregnancy. Okay, ladies, pregnancy. It's very natural, right? Our bodies were built to do it. It's part of the cycle of life. It is a huge stressor on the body. Your hormones are on the roller coaster ride of their life. Your body is shifting and changing. Your moods are all over the place. You're growing bigger. Your boobs are growing. Your stomach's growing. Your hips are growing. Everything is crazy. And it many, many, many times it will be after that first pregnancy, after that second pregnancy. It's like my body went to hell in a handbasket. What happened? Well, that is enough to turn on the Hashimoto switch. So if you think about that roller coaster and then apply even a portion of that to perimenopause and menopause, the same thing can happen.
And I bet there's probably, I'm just guessing here, a link between how old you are when you get pregnant. Like if you are in that perimenopausal window, I'm sure that it's even more profound.
Yes, yes, definitely. And women are having babies later these days.
They are.
So, yeah, there can be that overlap, and a lot of women are doing hormonal therapy to try to get pregnant. Maybe not all the way to IVF, but even just taking additional hormones that their OBGYN will give them to make them a little bit more fertile. I mean, think about progesterone, progestation. So oftentimes we'll give women high amounts of progesterone in order to kind of make them more fertile. Well, that alone sends the body on a roller coaster.
So, what should women be asking for with labs, or if they're working with their practitioner, hopefully somebody with that integrative functional approach, because it is difficult it can be intimidating to request labs from, let's say you go to your regular OBGYN and you get dismissed and you try to request things, doesn't always, doesn't well.
It doesn't. It's tough out there. It really is. So I would encourage you, okay, start with the doctor that you have. At least start there because here's the rule. If you bring in a list of labs that you want done on your body, and that doctor says, no, it's time to get a new doctor, anyways. If you're working with someone who won't run a test, which is no money out of their pocket. Like this isn't even, we're not even getting into the whole big pharma insurance conspiracy. It is no money out of their pocket to write reverse T3 on your little lab script. If they say no, then they're blatantly telling you, I'm sorry, I don't actually know what to do with this. If I test you, I'm going to look dumb when this comes back because I don't know what to do with these markers. I don't know what they mean. And I probably don't even have a drug that I can get a kickback on to give to you if these numbers are off. So that's your first sign. What you want to do when you go in is literally go in with the list of labs. So I'll tell you what those are for thyroid. And then you want to go in with a bulleted list of symptoms. Do not write a book. Do not write a paragraph. Do not write your life story. Do not, it'll immediately like they'll go blank. You'll lose them. You want to go in with a bulleted list of symptoms: weight gain, hair loss, fatigue, brain fog, constipation, depression, anxiety, joint pain, whatever it is that you're experiencing, and dig deep, like write it down, write it down. Then you go in and you say, I would really like a full thyroid panel. I heard this thyroid expert on a podcast. She was talking about the importance of getting my thyroid tested, especially now that I'm, after 40 here in perimenopause. So I would like TSH, free T4, free T3, FREE, reverse T3, TPO antibodies, which is thyroid peroxidase, and TG antibodies, which is thyroglobulin. And those are the tests that you need. And you write those out along with your symptoms. You hand it to your doctor, and I promise each and every one of you, your insurance will cover it. Like your insurance will cover it. If they try to bamboozle you and say, well, insurance won't cover that. I mean, just okay, if you want to call your insurance company to make sure, that's fine. But this is your first test of your doctor. See if they pass this test. And then you can continue working with them. And then that next step is looking at those labs through an optimal versus normal range, which we can certainly get into, but I'll pause there because I'm talking a lot. But that's exactly how you want to approach your doctor. And that is the rule that you have to adhere to, that if your doctor says no to labs, move on. Time to get a new
Mhm.
doctor.
I would agree 100%. And I've had no problems with the insurance, and I have all kinds of labs run and unconventional ones even, and I've had no problems. I want to encourage the listeners to push forward with that. Don't take one answer and think I can't get the help I need. Keep going. So let's talk about optimal versus the traditional red flag, because I know my practitioner, she looks for if it's on the low side of normal, or sometimes it's the high, not necessarily with thyroid, but other things. She looks for that range. Where am I at? And why is that important? Why does that matter?
Because whenever you get a set of labs done and you see next to your result, you'll see the standard range or the reference range. That range was actually derived from testing people in hospital settings, people that are in there who are sick, who are obese, who have heart disease, who have cancer, who have diabetes. Like that's who we're testing, which sounds crazy, to get the standard lab value range. Functional medicine comes in and goes, We would really like to test the fit people and the healthy people and the 75-year-old that's skiing down the side of a mountain and the 65-year-old that's still throwing weights around at the gym and looks like a badass. Like, let's test them. And that provides a much more narrow range because now we say, you're not going to feel good out here in this wide, vast standard lab value range. You're going to feel your best in this really narrow bullseye range. And if we can get you there, then you're going to lose the weight and your brain's going to light up. And you're not going to be anxious or depressed and have insomnia and erectile dysfunction and constipation and all the things that go along with it. So we know that when we can get people into that optimal range, that's where they're going to feel their best. Now, that might be hormone replacement therapy, i.e., thyroid medication. That might be bioidentical hormone replacement therapy. That might mean, in addition to that, changing up your diet, lifestyle, adding in some supplements for nutrient support. It depends what you look like because every person is unique, individual. There's no cookie cutter plan. But we can take that, we can take your labs, look at them through that optimal lens and say, okay, here's the levers that we need to pull to get you into that optimal range.
That is well said. And I've heard too that optimal range has kind of been shifting, especially like with blood glucose, like that's been shifting over the decades because now what used to be normal isn't normal anymore because people are sick. So they're testing people who have metabolic chronic diseases, for instance. And of course, that's going to shift everything around. So yeah, it's so important to look at those optimal ranges. Now, when we look at diet, you mentioned nutrition. Is there, and you also mentioned there's no one diet, which I love that you said that because I often see, like on Instagram, for example, people talking about the one way, just do this way. And I've had various people on my show. I've had plant-based, I've had carnivore, recently a gentleman who is into the carnivore, and then the paleo, all of the different things. So what do you think? How do we navigate this world where it's so confusing?
Yeah, I know. There's so much information out there. So I always say that your labs tell us how you should eat. So if you are truly insulin resistant, you're borderline diabetic, then that tells us, yeah, we have to kind of lean more into a lower carb lifestyle because there are some tried and true things that we know. We know that processed carbs, we know that high amounts of carbohydrates, high amounts of rice, eating too many sweet potatoes, even though they have nutrients and a nutrient value to them in your body will spike your glucose, will cause your pancreas to oversecrete insulin, and you will constantly be in this fat storage mode instead of a fat burning mode. So your labs really do tell us a lot about how you can eat. Now, there are some tried and true rules, we'll say. And I mean, you have them with rheumatoid arthritis. So whenever we're talking about autoimmune conditions, and especially Hashimoto's, but this applies to all autoimmune. We have to go gluten free. I always joke and say, I promise, gluten free is not a fad. This is not like yes, it seems like it took the world by storm, and now we have 5 bajillion gluten free products out there on the shelves. But it's not a fad. There's science to it. So when it comes to the thyroid, gluten, which has a protein molecule called gliadin, when we look at that under a microscope, we go, wow, that really looks like the same molecular structure as the thyroid gland. Now, remember we said earlier about those little soldiers, those autoimmune, they're your antibodies. So when you test that TPO and you test that TGA, whatever number you get for those two values, those are how many soldiers you have in your body that are going out and beating up your thyroid. Whether it's 20, 100, 5,000, doesn't matter. Those soldiers go out and they beat up your thyroid. Now, here's the thing. Whenever we eat something containing gluten, those soldiers go, hey, you know that bad guy, the thyroid, that we like to go out and beat up every day? Turns out he's got a friend that we obviously need to go start a war on because that guy's not good either. And it literally sees this gluten coming into your body as another invader. It launches a full out war. So not only are you spurring on your own autoimmune attack, you're also building your soldiers up because they will multiply when we eat gluten. Now, you might be sitting there going, I don't notice anything. What do you mean an autoimmune attack? Well, it doesn't have to be blatant. It doesn't have to be like, okay, I ate gluten and then all of a sudden I'm tired and I put on 5 pounds and I got this brain fog. Oh my gosh, I feel like garbage. It doesn't have to be that. It might be that. If you're lucky, it'll be that because that's a nice punch in the face to never do that again. But some people aren't that lucky. Some people, it's just like, well, I just had a little bit. I'm 99% gluten free. I'm like, yeah, that's like being kind of pregnant. Like it just doesn't really work, does it? Like it's one or the other. So that 1% of gluten that you're taking in every day. Oh, and you're wondering why you can't lose the weight? Oh, you're wondering why your doctor wants to hand you an antidepressant because you're depressed and anxious. I see. How about we make this change, go 100% gluten free, then reevaluate and see how you feel. And I'm totally fine with people using the thyroid hormone replacement. I'm totally fine with people stacking on things like black cumin seed oil, which lowers inflammation and lowers antibodies, low dose naltrexone that lowers antibodies. It's great for all autoimmune conditions. Same with black cumin seed. But you got to do the lifestyle and nutrition component as well, or all these beautiful hormones and therapies that we put on you over here are not going to work.
No, very, very good advice. Yeah, gluten, what I have found with myself, if I let it creep back in, is I will have the joint aches. That's the
Mhm.
first thing I'll notice. And then I'll have the fatigue. But it's not a big punch in the face. It's kind of subtle. Like I pick it up because I think I am. I'm in the health industry. I'm very aware of my body. Competing, you know how competing does, it makes you hyper aware of your body. And so I feel this, but maybe somebody else might not. They might just think, oh, I didn't have a good night's sleep, or oh, I worked out too hard at the gym. My joints are aching today.
Exactly. Oh, that's so true. It's like that slow creep that almost is unnoticeable until you have so many symptoms. You're like, wow, my life is not the same anymore. I feel like garbage.
And the bloating. I failed to mention that. That's another red flag for me when those abs wash out and
Yeah.
I'm bloated. You can't see your abs. I know. Okay. I've let something creep back in. Now, you're working with women primarily. You had mentioned men, but when you're working with women, what is the most common scenario that you see, or is there a common one?
You mean from start to finish?
Yes.
Sure.
Yes.
Yeah. Okay, common scenario. Woman is has all the symptoms that we mentioned, whether she's gaining weight, can't lose no matter what she does. It doesn't matter if she goes on paleo, keto, carnivore, nothing is working to take that weight off. She's tired, she might be losing her hair, the constipation, brain fog, depression, anxiety, to where conventional docs love to give out the Band-Aid medications. They love to hand out antidepressants and sleeping pills left and right instead of uncovering what is causing that depression, anxiety, and insomnia. Woman walks into the doctor's office. Sounds like the beginning of a bad joke. Woman walks into a doctor's office and tells doctor, "Hey, these are all the symptoms." I mean, it's the same story as I had 20 some, 30 some years ago. Is these are my symptoms. Something is wrong. I know my body. Something is going on, and you get dismissed. And then that woman, after being dismissed, let's say she'll bounce around the insurance based system for a little bit because we pay for insurance. We want to be able to use our insurance. But reality is you're probably going to have to branch outside of the insurance based system. It just is because doctors are taught in medical school. They are taught all you have to do is test TSH. If TSH is above a 4.5, which is the cutoff on the standard lab value range for sick people, if TSH is above a 4.5, then you give T4. It's like this very simple Venn diagram. Like then you give T4, you pat them on the back, wish them a good luck, and tell them you'll retest them in 6 months. So that is standard of care for thyroid. It blows my mind because we already talked about how many tests there are, and thyroid treatment is so beautifully nuanced. It is so beautifully nuanced. So I'm gonna go off the road here for just 1 second on that point. I gave a talk years ago to a group of integrative wellness physicians. They wanted to go deeper in thyroid. They were conventional docs, turned integrative, wanted deeper training. So I started talking to them about all the different tests that we need to run. And then I started talking about treatment. And I said, there's so much out there. We have liothyronine cytomel, which is straight up T3. We have natural desiccated thyroid, Armor, NT thyroid, which is a blend of T4 and T3. We can compound T3 only. We can compound slow release T3. We can compound T3 and T4 together. We can change the ratio. We can make it 30% T3 and 70% T4, flip it around, 70% T, 30% T4. We can do anything and you're all in this Synthroid box. Why are you in this Synthroid T4 Synthroid box? And the one doc raises his hand and goes, that's all we've learned. And I was like, well, thanks for being honest, but that's why you're here then, to unlearn this and get out of that conventional based training that you've been boxed into. So that was a side note to drive home that point that literally, I mean, you'll bounce in the insurance system for a while, T4 only, it's not going to work. Or, oh, we'll give you this little baby dose of T3 to placate you because you keep asking for it and you're such a squeaky wheel. Here you go, Carol. Here's a little bit of T3. And you'll get all excited about that. You'll try that for a while. And then you'll realize that that baby dose is doing more harm than good because it's totally shutting down your thyroid production, but it's not feeding every single cell in your body that needs T3. And then she'll go to functional medicine. Now, here's where we have to get down and dirty. This is my public service announcement to your audience. Please do not just go to anyone that has the term functional in their marketing material or integrative or alternative in their marketing material. Please do not fall for all we have to do is insert the protocol here. All you have to do is do a gut protocol and your thyroid will be fine. All you have to do is sprinkle adrenal fairy dust on yourself and it'll be fine. No, you need to work with a thyroid and hormone expert. Because like me, I mean, I am a functional medicine provider. My entire team is functionally trained, from functional nurse practitioners to functional MDs to functional diagnostic nutritionists. We are all trained in this way of thinking. We don't sit here and go, oh, well, you know what? We can help with your, XYZ too. It's something outside of our wheelhouse. We say we are thyroid and hormone experts. You come to us for thyroid and hormones. Now, one of my nurse practitioners is fantastic at mold, but we don't sit here and go, we can help your thyroid by treating your mold. Like, no, we're going to treat your thyroid and your hormones. So you have to work with that functional integrative practitioners practice who that's what they specialize in. That's what they specialize, because functional has become such a buzzword.
It has.
Such a buzzword. So I would say that's the journey of a woman going through this that we see over and over every single day in the practice. We have people coming in with the same story. It's sad, but it's typical.
I love so much that you hit on this. I think it's really important. I'm seeing the same thing in the space. All of a sudden, everybody is a menopause specialist.
Don't even get me started on that.
I know, hormone expert. It's everywhere. It's almost like people see an opportunity. I don't like saying this, but a money grab, and boom, they're all over there for that money grab. And you have to be so careful as the consumer. What specific things should they be looking for? Now, you said they should be looking for somebody that's not trying to distract you with, oh, and we're going to test for toxins and lead and all of the things, right?
Right. Yeah, I'm not a believer in dropping thousands of dollars up front on these functional tests right off the bat.
Yeah.
I really don't. Every person is so unique. Why should you have to pay $500 for a GI map and $700 for a tox screen when that might not be it at all? Like, when we literally just adjust your thyroid and hormones and you go, oh, well, that's it. I got my life back. Thank you. Like, why would you need to drop all that money on these functional tests? And I mean, if you want to go down that rabbit hole and explore and you have unlimited funds and you're like Brian Johnson or Dave Asprey, fine, that's fine. But most people aren't. Most people are on a budget. Most people want to get their health from A to Z without breaking the bank. So I don't believe in that whatsoever. We will order those functional tests after we start working with someone based on their progress and their symptoms. So it might be like, oh, yeah, okay, you were diagnosed with H. pylori in the past and you're still having these gut issues and there may be an absorption problem happening here. So, okay, let's run another GI map or something like that. But that's when we'll bring in the functional testing. I would say the other big red flag, please do not do these online cookie cutter telehealth programs for like $159 a month where, oh yeah, you're going to get your hormones. No, there's inherent dysfunction in those telehealth clinics. Now, we started seeing all of these pop up for guys, right? It was TRT, where they were giving guys testosterone left and right. It's like, all right, well, you can't F that up too badly, but I mean, you can, but it's just testosterone. You're giving it to a dude. It's pretty standard. The problem is when people started seeing the dollar signs, like you just said, and went, oh, you know what? With all these menopause experts out there and 5 million menopause books now, we can now incorporate in some estrogen and progesterone, and we're going to give every woman the same. She's going to become an algorithm, and we'll give her some testosterone too. And we can do it on the cheap because all we want is the masses now. We just want the volume. So we're going to treat everybody the same. And even if 75% of these people don't get better, we're getting more people in every day because it's only $149 a month. And you are just literally an algorithm. You are a number. Carol, I've seen the behind the scenes, and it's not pretty. It's not personalized. Like, I just literally shook my head, even with thyroid, and I went, you are going to mess people up with it. No, you can't do this to women. Every single woman out there is complex and unique and just needs like a different blend. Maybe this doesn't work for her, but this does. And you need someone to hold your hand and figure you out. And an algorithm and a cookie cutter plan isn't going to do it.
Yes. I mean, you are speaking my language here because I'm constantly saying, a couple of different things. It's never one thing. So women are
Mhm.
always looking for, if I just find this one thing, I'll lose weight or I'm going to feel better and have more energy. No, our hormones are part of a symphony. It's not one thing. And then this, like you said, these clinics, these online things just popping up everywhere, and they're not personalized. Everyone is different. I mean, I currently have a client now. She can't touch vegetables because of an autoimmune condition. In fact, I've got a couple that are in that boat, and you've got to kind of pull the vegetables back. So yes, vegetables are healthy. Vegetables are great, but it was really tearing up the digestive tract. So you have to look at each individual, and you give out blanket advice, you're going to hurt someone.
You really are. You really are. I mean, I have a patient slash friend right now where she just messaged me over the weekend. She goes, no, I gave this testosterone injectable a try again. And I immediately blow up. Now, I will tell you that 99% of our women do testosterone injections. They love it. It's easy. It gets them optimized. But you always will have that 1 to 5% that, I mean, thank God she's working with us and we can change things up. Because if she was part of the cookie cutter clinic, they'd be like, no, that's not doing it. Here's more testosterone. You're fine. And she would end up gaining weight and being miserable.
There's always those outliers. I say that where you have a formula. Maybe you're a fitness coach or you're a health coach, and it's like, okay, you have this formula of way of eating, way of exercising, and then here comes that individual. It bombs, like it doesn't work for them.
Exactly. Exactly.
So, such good stuff. Now, I don't want to forget to ask you this because this came up in my mind as we were talking nutrition. What are your thoughts on intermittent fasting and the thyroid? Is there a connection there, positive, negative, or maybe both, depending on the situation?
Yeah, I think intermittent fasting has a role, has a ton of benefits that we know and that are documented, from cancer to obviously diabetes, better weight control, all of it. However, since hypothyroidism, like we said, affects women more than men, with women, what I find, I'd be interested to hear your take too. With women, what I find in the nutrition component is if they overfast. So they go in, they go, heard about this intermittent fasting thing. I'm going to do 16 hours of fasting and I'll have like 8 hours of eating, or I'm going to do 20 hours of fasting and only eat in 4 hours. Well, I will tell you, number one, it's hard enough for women to get in enough protein. And that is vital. You talk about it, I talk about it, protein. It really is. It's vital. So now you narrow that eating window down. Now, is she's definitely not going to get in her protein in 4 hours. There's no way. Maybe 8 hours, maybe, but
Stretch.
that's stretching it. I'm okay with a 12 or a 14-hour fast. I really like 14. I think that's a nice sweet spot for women. But anything over that, it starts getting tough getting in your nutrients, getting in your protein, your amino acids. The other thing is it's a stressor on the body. So if you're white knuckling your fast, then that's your body saying, maybe today is not a good day to fast. And if you override your body's signals, then now you're creating a stressor. Now you're pumping out cortisol. Now that cortisol will increase your blood glucose and it'll make you insulin resistant. And insulin and high cortisol will impair thyroid hormone production. It will impair that T4 to T3 conversion. So now you're doing more harm than good.
Yes, I agree. I have the same philosophy. We've talked about this on your podcast.
Mhm.
Same philosophy. I mean, there can be benefits to the 16-hour under certain conditions, but I know for myself, I wind up starved, first of all. So the tendency is to eat too much in that 8 hours. And then I found myself wanting more carbohydrates because my energy was tanked. That's just me. That's how I responded. And it was difficult to get that amount of protein that I need in that 8 hour window.
Yes. Yes, definitely. Definitely. That's my take.
And finally, I want to ask you exercise. How should women be exercising?
They need to lift heavy stuff. So, here's the thing with exercise. I understand that some people have injuries, some people
Mhm.
have restrictions as to what they can do. But I think we all need, and I'm not in the camp of like, well, just move, just walk, or just do some yoga. No, you need to do resistance training. We need to have some type of resistance against us. And that can be body weight. It doesn't have to be weights. Even just doing an air squat, doing a lunge, doing a push-up on your toes, on your knees, off a bench, whatever is providing resistance to your muscles. And then you can progress and obviously do the machines like the Nautilus machines. You can pick up free weights. You can work with a trainer. There are all things that you can do to get that resistance training into your life. And the reason why I say this, and I know you've talked about it before, is that is what builds and protects our lean, sexy muscle, which protects our entire body. It protects our muscular skeletal system. It protects us from falling. And this might not be something that's on your radar at the age of 50, but it's definitely going to be on your radar at the age of 70. And then you're going to look back and go, if I only would have started resistance training at the age of 50, maybe I wouldn't be here by now. We know that if you fall and break a hip, you have a 50% chance of dying. 50% of going into a nursing home and passing away in that nursing home. And that sounds so crazy. You go, what? How is a hip fracture going to kill me? Well, we have the stats and it will. We know that when you have that muscle protection around your bones, you can take that fall. It's not going to break a hip. You're not going to fracture it because you've been doing that resistance training, which builds the muscle around it. And I'm not talking about looking like a bodybuilder. I just mean just keeping on that muscle that we do lose as we age. Now, you also have to be keeping your testosterone levels optimal. We need that beautiful progesterone and estrogen for bone to prevent osteoporosis. We need your thyroid working well, and we need to be eating protein as well. But that resistance training just puts that extra cherry on the top to give us a whole other layer of protection. Now, we also know that muscle is metabolically active. Muscle protects us against diabetes and type 2 diabetes and insulin resistance. It helps keep our weight in check so we're not walking around with the excess body fat that in and of itself has additional all-cause mortality issues with it. So I am just a firm believer that you need to figure out a way, even with restrictions, you need to figure out a way to incorporate some kind of resistance into your life.
Agreed. And it can be done. I will attest to that. I'm going to be 64. I've had a spinal fusion a year ago. I had a bicep tendon and a rotator cuff surgery in February. And I have muscle on my frame. Now I've had to modify and I've had to move around the gym and I try all different movement patterns, all different machines. That felt okay. No, that hurt my back. Nix that. It can be done. You just got to work with somebody really who knows what they're doing or, get creative. Start, trying different things, different machines, but don't just throw it all out and say it cannot be done.
Agreed. Totally agree. Yep.
Dr. Amie, this has been a pleasure. You have so much to share. And I want to thank you for being on the show, sharing with me, sharing with the listeners. I've learned some things just speaking with you. As we wrap up, want to be respectful of your time. Two questions. Did we miss anything that you want the listeners to know? And How can people work with you, follow your work, and get in contact with you?
Well, one thing I will mention that we didn't cover yet, I need to send you a bottle of Hashimoto's Fixer. So we talked about black cumin seed oil. I have the Fixer supplement line, like you mentioned in the beginning. In that line, I have Hashimoto's Fixer, which helps with autoimmune conditions and inflammation. So I got to send you a bottle of that for sure. I also have a product called Thyroid Fixer, and I have Metabolism Fixer, and that contains T2. So we had talked a little bit earlier about the importance of T3. So all my ladies out there that, we just went over, okay, you need to get tested thoroughly. You need to talk to your doctor, all of that. If you are on T4, and you're like, yeah, I'm hearing Dr. Amie talk, and it turns out, yeah, T4 is not working for me either. She was on it for 5 months. I've been on it for 5 years, and the weight's not coming off, and I just don't feel any better. I have something, I have a tool that you can put in your tool belt that's going to help. So T2, Thyroid Fixer, and Metabolism Fixer both contain it. It will increase your basal metabolic rate. It will literally increase the amount of fat that you are burning at rest. It will help your thyroid function better. It doesn't affect your numbers. Your doctor's not going to look and go, "What are you doing, Carol? Are you sneaking some thyroid medication in there?" No, no, no. It's not going to change anything. It's not going to, it doesn't feel like the fat burners of the old days where we thought our heart
Oh,
was going to explode, right?
terrible, terrible.
Does none of that. It literally works at the cellular level, at the mitochondrial level to increase your metabolism, increase ATP production. So you can get a win in the weight department, in the brain fog and motivation department, and in the energy department by incorporating those in. So I just wanted to throw that out there because I know a lot, even based on our whole conversation, there's still women out there that are going to go, I can't afford functional medicine. I can't work with you, Dr. Amie. I need to stay in the insurance-based system, and these damn doctors are only going to put me on T3 or maybe or T4 or baby dose of T3. So I just wanted to throw out that tool for your listeners that they can absolutely incorporate that in, and it will help. It will help with those symptoms. Yep.
Thank you so much. That it's great to have an option like that because, like you said, not everybody can afford to go outside the insurance system, unfortunately. And then, what do they do? And this gives them an option.
Right. I love having options for people. Now, if you are in that space where you're like, I'm done. I'm done with these insurance doctors, or I'm done with the functional medicine scams that I've already lost thousands to, you can absolutely apply to become a patient. So we offer free calls just so we can chat over your health history, what you've done, what you've tried, what hasn't worked, and we can all determine if we're a great fit to work together. So you can do that. You can book a free call. You'll go to dramie.com, DRAMIE.com. And that's where you can click on the book a call page. You can click on the shop and go to the store if you want to grab some thyroid fixer, metabolism fixer, or anything else in the fixer line. And then, of course, there's the Thyroid Fixer podcast that Carol was also a guest on. And that's a great place just to dive deep and learn more about thyroid hormones, the whole thing.
Wonderful. Thank you, Dr. Amie. Really appreciate you. Going to make sure all of your information is in the show notes. Thank you for being on the show.
Thank you so much for having me.
And to our listeners, wherever you are in the world, we wish you every blessing. Bye for now.